Embodied and Expressive and the gesture. And so without further ado, I'd like to welcome Dr. Heather Buchanan.
Hi, everybody. Thank you so much for that lovely introduction, Max. And thank you all for coming back. You know, that's always the fear, isn't it, when you're a guest presenter, that if people just, the natural attrition rate sort of results in a plummet. So welcome to the new faces, and it's lovely to see some faces that were familiar from last night. And guess what? The blue screen got fixed magically today. So yeah, let's hope that the chewing gum holds a little better than it did last night. So I just am going to, we're discovering all sorts of wonderful things about Zoom. And I'm going to do a screen share now for you all. And in addition, I have the capacity to actually get rid of all of that annoying who's in the waiting room stuff. So if you just be patient for a couple of seconds, I am going to hide those controls so Max and Eric can take care of that, and I can just focus on all of you. Okay, so embodied and expressive. Tonight, we're going to map our conducting gesture. And I thought we should just start with a little recap from where we left off last night with core balance and what this means for our conducting. So we talked about, now wait a minute, Eric, that didn't work. That's interesting. Sorry, everybody.
Showing up last night too.
Yeah, just give me 1 second. We really want to try and get rid of that little thing that keeps rolling down. And I had hide floating meeting controls, and
it wasn't checked. So
I've just redone it again. Let's hope that that works.
Okay.
So, yep, because there's nothing worse, is there? Okay, so we're getting there. So let's just go back to conducting and core balance and why this is important. As you see on the slide, I've just started with the point that effective conducting utilizes the whole body that is supported and organized around the spine, which is our central core structure. Tonight, we're going to look at how we can balance our arm structure elegantly over that weight-bearing, weight-delivering spine. And we're also going to explore a little bit about leg movement. So if you're really keen to work with your conducting gesture tonight, just organize your personal space so that you can be up and down, and I'll be doing the same. But we're not just going to think about arms in isolation. We're thinking about arms as they connect to the whole, and we're going to talk a lot about the kind of leg movement that supports the arms. We also talked last night about how demanding performance is. And I think you might recall I said that when we're
interrupting your call, let me turn that right off.
We good? So we talked a little bit about diminished performance capabilities or severe injury being the consequences of an inaccurate or inadequate body map. Because we do so much repetitive movement, this places us at injury. And one of the statistics I mentioned to you is anywhere from about 76 to 85% of musicians are likely to report a playing related injury as a result of what they're doing technically or what they're not doing technically. So body mapping is a wonderful way of rehabbing. It's also a fabulous way of prehabbing. We do what we do for much, much longer than athletes and dancers. Musicians perform, most of us, well into our golden years, and some of us just never retire. So it's important that we have mechanical advantage. And I'm wondering, Max, maybe you can add this into your competition. I'm wondering if you can recall the 3 enemies to fluid, poised movement. We have tension, misalignment, and excessive force. Just excuse me a sec. So Eric, that's not working because I'm still seeing it. Are participants still seeing that?
they are. We're going to just, Max and I are going to try to let people in as quickly as we possibly can. I'm not sure that we thought we had that, but so we'll get them in as quickly as we possibly can to get that there. I'm not sure why the check mark isn't showing up.
Yeah, it worked this morning, but every time I check it, there's nothing happening there, so I'm not sure. Anyway,
so we'll work as quickly as we can to let people in and get that bar to go away as quickly as possible.
no worries at all. Okay, so we'll let Ada in, and then we're good. Let's recall what our 6 places of balance are. Okay, so number 1, the atlanto-occipital joint, known as the AO joint. Number 2, lumbar spine. Number 3, hip joints. Number 4, the knees. Number 5, the ankles. And number 6, the arm structure, which is where we're picking things up tonight. So knowing that you can perceive balance anywhere that you have a joint, instead of worrying about every joint in your body, we recommend you take care of these major intersections here, so that you can, in fact, enjoy the flow-on effect, which comes up and downstream of those locations, so that you have fluidity, ease of movement, also known as mechanical advantage. Let's try some movement experiments. So I would like you, first of all, to stand so that you have your body, and I'm going to show you a little here. And as I move away from the microphone, my voice will seem a little further away. That's just natural because of the microphone positioning. So what I would like you to do, first of all, is get yourself organized over the arches of your feet. So let's just take a moment to find the balance of the skull on the spine, releasing at the AO joint. I'm wondering how many of you had a go at those stretching exercises I taught you last night. And then we're going to organize that AO joint over the lumbar spine. So we're thinking front to back, side to side here. And then remember, you want your pelvis to be at neutral. So that will help get the knees into soft. So we've got hip joints down to knees. And then we're delivering the weight down the front part of the lower leg through the ankle into the arch. And you just want to experiment with how that feels, going from the heel to the ball of the foot. And also just take a peek and see whether or not your feet are parallel or whether you've reverted into Disney feet. Some of you are probably used to that feeling of the outward turn. So I'm just going to encourage you to gently see where you can get. Don't force anything, but see what you can encourage in the time we have tonight. And then I want you to see how it feels to bring your arms up to an anticipatory position and to simply conduct a legato 4 pattern. And I want you to be thinking about that lovely buoyant head, that buttery free neck. And I want you to explore legato. And we're going with legato because that is where the majority of our conducting needs to be. And I think for many people, it provides the most challenge, actually. So we want legato without unnecessary holding or strain. Now let's try a couple of experiments. So first of all, you'll see on the slide here, I say, notice the effect of your head when it's in and out of balance and what that does to your arms. So let's be in balance for a moment. And we're going to conduct our legato 4 pattern at any dynamic that is pleasing to you right now. And then I'd like you to try a position with your head and neck that introduces either tension or misalignment. I'm going to go for forward head position, which we talked about last night. And this is one that's very common. And I'd like you to see what happens to your arms. How do your arms feel when you're in this position? And if you're not sure, close your eyes so that you're really focusing on your kinesthetic sense, which is the movement of your body at the joints. Alternatively, you can also try the drum major position with the head pulled back, the chin tucked in, and working with your arms this way. 2 things come to mind. First of all, when I go into forward head position, my arms feel quite heavy and tired. And I find that I have to work harder to maintain the legato. When I pull my head back and tuck my chin this way, I find that I lose arm. It feels like my arms are shorter somehow. That's my experience. Think about your experience, and some of you may even like to try these experiments next time you have live singers in front of you. It's quite instructive what our gesture does to their sound. So how easily can you attain and maintain the legato gesture? Well, when we're just here for a moment or two, even with extremes of poor alignment, we can still manage to go. But how would it be if you were conducting for 3, 4, 5, even 6 hours a day and needing to keep that gesture free? How would you pull up then? For many musicians, they don't notice the flaws in their movement patterns until they're in concentrated activities where they're having to do the movement more intensely and for longer periods of time than they would in a regular week. So that's something else I'd like you to consider. The final question I have for you is, what is the relationship between your legs and your neck, your legs and your arms? So let's try that again. Come to neutral and start your legato 4 pattern. And I want you to direct your attention in the first instance to your legs and notice what sense of connection you have with your legs and this arm movement. And this is just something for you to consider as we work tonight. And then think about the relationship between your legs and your neck. Some of you might find that your neck gets quite tight if your legs get quite tight, just as mine are here. I wonder whether you can keep a free neck and have tight legs. Let's try that. So add tension to the legs and work to keep your neck free. I can do it, but my arms feel kind of wild and out of control. Having a tight neck makes it impossible for me to have any freedom in the arms or the legs. So that's just a little reminder about the interconnectedness of things. And for many of you, a really, I think, strong reminder that we're conducting with a whole body, not just arms. And it's incredibly important that you think about yourself as a whole being. Last but not least, I want to know how clearly you feel you can convey meaning when you're conducting in these different positions. So for your homework tonight, or even tomorrow morning before we start up again, conduct in front of a mirror. Look at yourself, think about what it is that you're trying to communicate, and notice the difference in that ability based on your alignment and the connection to your gesture. How is it that conductors can maintain freedom of motion, maximize their gestural or expressive vocabulary, stay physically and emotionally grounded, and remain pain and injury free? We could ask this question of instrumentalists, people who have static posture, which is necessary when they're holding an instrument. Our arms are continually in front of us, sometimes toward the side. And especially when people are holding a baton. I see so many people holding a baton that looks more like an instrument of war than an expressive musical device. The answer is through optimal body organization. If we organize ourselves around core balance and we have mapped a complete arm, then our arm movement embodies what we call humeruscapular rhythm. You could see the definition there. Humeruscapular rhythm is the fluid sequential movement of a complete arm structure. So what I'm going to do is show you that whole arm structure, and I'm going to get you to palpate, which means to examine by touch different parts of the arm And we're going to look and think and reflect and experiment with that and see just how accurately you already have your arm mapped. Free arms are at the mercy of many things. In the first instance, a free neck. We're working toward a balanced head. We're working toward balance in the torso. And remember, we don't stay static when we conduct. We're moving all the time. The point about core balance is that we're organizing ourselves around balance so that as we conduct, we move in and out of balance. And each time we come back to balance, our body has a moment of release because we don't have to use excessive force, and there's a release of any potential tension. Free arms also depend on free legs. You got a hint of that just now. And number 5, which we're going to get into in detail tomorrow, dynamic gathering and lengthening core. Our spine has interesting movement called gathering and lengthening, and it's an involuntary movement as long as we don't have unnecessary tension or misalignment. So let's talk about how we communicate non-verbally with our ensemble. How many of you are confident in your gesture that you can show what it is that you want? How many of you have been trained by your choir to talk and tell them what you want, and then they look away and do their own little thing anyway, and you're there sort of working like a glorified metronome? How many of you think very clearly about the musical information that you want to convey? And how many of you are confident with your technique and are very clear about when technical priorities need to assume most importance and so forth? So the integration of elements that I'm going to list here is a little roadmap for where we're going tonight. Oh, and before I go through there, I wonder if any of you have looked at this little collage. It's one of my favorites. These are all fabulous women conductors, and we are horribly underrepresented in the professional world, but you can see some really spectacular women there, and of course they're static photos, but I think there's some really amazing intensity and movement captured in these images. So we're going to start by mapping the arm structure. We're going to talk about the concept of support, support for our arm movement and support for the choral sound. I'm going to explain to you my concept of gestural axis and center. Some of you will disagree, and that's perfectly okay. This is just some ideas that I have been working with for quite a while now, and I'm really happy to share them with you in case there's something there that could be helpful for you. We'll cover some reminders about your anticipatory position and your breath impulse gesture. We're going to cover breathing as an entity tomorrow, but today I do want to talk to you about the importance of how we use breath to phrase and to impel the sound. We're going to cover a little bit of work on stylistic elements and patterning, specifically around legato. We don't have time to get into a lot of different articulation and marcato and staccato, but you'll get a sense of what's possible there with what we do tonight. And then we have our intention and imagination, which is just really a reminder. And then finally, I want to remind you all about the importance of listening and awareness. So that's our roadmap for where we're going. Let's get started with the arm structure. And I have with me tonight, Mr. Bones. He's back. So you can see our little miniature man here, all 18 inches of him. And I have brought with me also an adult arm structure. To start with, and Max, you might be able to get a fun screenshot of this one, if that's possible for you. If not, don't worry. One of the things that I always ask in these workshops is, please show me where your arm begins, your right arm. Where does your right arm begin? And I get a lot of different answers. the majority of people would say somewhere out here or somewhere up here. In actual fact, the arm structure begins here, where the collarbone meets the breastbone. And we're going to go through these different joints in a moment. I have an arm structure here that I can also show you, and you're going to be able to see. Sorry, it's just got itself a little twisted up in my office here tonight. Oh, Lord above, what's happened? And I can, in a minute, when it untangles itself, okay, there we go. We have the collarbone here, and this place where the collarbone comes to the sternum is why we have a sternoclavicular joint. So this is probably going to be a bit of a revelation for people. Let's look at all of the structures on the slide, and I'll also show you with my model. So first of all, we have the collarbone or the clavicle, which I've just shown you, and then we have the scapula or the shoulder blade. So these guys are joined right here at this little joint here. So here's the back view, here is the front view. So if you take your index and middle finger and make a V like this, and you work like this with it, that will give you the idea that the collarbone is connected to the shoulder blade, okay? Our third structure is the humerus, which is our upper arm bone. We then have the lower arm, which features two bones, the radius and the ulnar. And I'm just going to lay this over my arm so you can get a sense. And then we have the carpal bones, which comprise our wrist. And then we have the metacarpals and the phalanges that comprise the hand. So this is a whole arm structure. And I'm just going to stand back a little and let you see how this could quite easily be my arm structure. It's in all of the right dimensions. When people look at a model like this, one of the things they say is, gee, it looks long. And look how long those fingers are. And the truth is, your arm is longer, and for many of you, longer than you think. So if you imagine that your arm begins somewhere out here, tonight, we're going to get you a chunk more of arm. And that's a beautiful thing. So the four arm joints that I want you to get clear about are the sternoclavicular, the humeruscapular, which is a made-up name. It's actually the glenohumeral joint, but we call it humeruscapular for reasons that I will explain in a moment. And then, of course, we have elbow and wrist. And this little image that you see here is looking down over the rib cage and the arm structure, and you can see this line, which is meant to be the line of weight delivery of the arm structure, delivering weight into the weight-bearing part of the spine when we have our arms balanced elegantly over those ribs. Let's get into the first joint, known as the sternoclavicular joint. So here we have the breastbone or the sternum, and here we have the clavicle or the collarbone. So sternoclavicular, it's a really logical name. That's the joint there. And the thing about the collarbone is because it pivots at the sternum, when it moves, the rest of the arm moves with it. So let's try a little experiment. I want you to palpate that collarbone. So come from the outer edge and start to work your way along until you get to where you feel it runs out. And if you just gently and slowly roll your shoulder backwards, you should feel a little bit of movement right there. So that you're aware of the relationship of the right arm to the left arm, let's palpate the left arm. So come along the collarbone, and then here it is. There's my sternoclavicular joint for my left arm. So you can see here that left and right arm both begin almost at the very physical center of the body. They're literally just an inch apart, which is really quite amazing. And because the collarbone and the shoulder blade are joined, where one moves, the other moves. And this is one of the reasons why we have wonderfully mobile shoulder blades at back. The other reason is that our shoulder blades attach to our spine with connective tissue, not at a joint such as the sternoclavicular joint. And that's another reason why we have all of that lovely freedom and mobility in the shoulder blades. Let's try some experiments to see if we can get you really mapping that joint clearly. And I will say that an absence of awareness of this joint is one of the #1 problems for musicians. So I'm going to scoot back a little bit so you can see. And I'd like you to put your left hand fingertips on the right sternoclavicular joint. And then I want you to just raise your right arm to 90 degrees and back down. Try to release your neck while you're doing that. And just focus on the sensation of flapping your arms like a bird, except you're only going up to 90 degrees. You shouldn't feel a whole lot of movement there. There'll just be a little bit of movement, but it's not a movement of this joint at this point. But what happens if we go above the 90 degrees and start to bring our hand up over the top of our head? Do you feel it go? Isn't that fantastic? So let's try that again. Up to 90 degrees and down. That's actually a movement at the glenohumeral joint. But the minute we bring our arm up past that 90-degree mark, now we have movement of the sternoclavicular joint. And you can feel that on both sides. So to raise your arms above your head requires release at these joints. You can also feel it when you reach forward. So this time, just bring your arm in front of you, but just keep it at what we would call arm's length. Don't reach. Just bring your arm up, just swing your arm up and bring it to 90 degrees there. But look what happens when we reach forward, like we would if we were swimming freestyle. You can feel that movement at the sternoclavicular joint. So this is a really crucial moment to map. A couple of things you can practice to do that. Just try freestyle swimming. Imagine what it would be like if you were freestyle swimming without this part of the arm. If you thought your arm began out here, what would you look like? It's like a really bad doggy paddle, right? But if you use a whole arm and you're moving from your sternoclavicular joint, then you have this beautiful full fluid arm movement. Let's move to the second joint, which is the humeruscapular joint, only called that because we want you to think about your humerus coming up to your scapula, which is your shoulder blade, right? This is a ball and socket joint, and obviously we've got bits of metal here because he's just a model, but you can see in my little animation how that multi-axial synovial ball and socket joint works. This is the most mobile joint in the human body. And of course, we have rotator cuff muscles that help to keep it stable. Injury at this joint is common when people are not mapped here and they try to move the humeruscapular joint or the glenohumeral joint beyond what it can do. Think about stretching a rubber band beyond what it can do. And that's what happens often when people get rotator cuff tears, because they're trying to move in one of the many directions that the arm can move at this joint, except they're placing undue stress because they're locked here. And this is, in some cases, it's an absence of awareness. In other cases, it's a conscious choice. So you can see in my little illustration here as well, my little divided man. So we have the front view. So you can see what the glenohumeral joint looks like from the front. And then we have the back view. And you can clearly see the humerus there and its relationship to the shoulder blade at the glenohumeral joint. Now, how do we map that? This is actually easier than you might think. Just simply take your fingertips, put them up under your armpit, and just feel it there. Or you can take your thumbs, hook them underneath, and flap like a bird. And when we're working with little kids, that's what we do. We just tell them to do the chicken dance. So our first joint is the sternoclavicular joint. Our second joint is the glenohumeral joint, which in body mapping language we often refer to as the humeruscapular joint. The kind of movement that we can do there, well, we've got flexion, we've got extension, we've got adduction and abduction, we've got rotation, right? And then we've got the capacity to move in circular motion as well. So there's a tremendous amount of flexibility there. Again, terribly important that we take care of this joint in relation to the whole arm as well as the whole body. So after those two joints, most people are thrilled to get to the elbow because they think, well, this is easy. I know what an elbow does. And so I'll grab my little model, Kiki, here and show you, what do elbows do? Elbows can bend and unbend, right? But elbows are more magical than that. If you have a really close look at my model here, you will see that there are two bones. We have the ulna, which I'm going to try and hold him in place here. We've got the ulna, which is the longer of the two, and then we have the radius, which is the shorter of the two. And I'd like you, please, to hold your right arm in front of you with your palm facing the ceiling. Okay, we call that a supine hand position. Okay, so your palm is up. Now have a look at the architecture and you will see that the radius here has a circular shape. And in fact, it meets the base of the humerus, but doesn't connect into it in the way that the ulna does. So when you hit your elbow and you think that's your funny bone, actually you're hitting a nerve, a very important nerve that helps to preserve reliable sensation in your extremities, but you're actually hitting typically the end of the ulna, not the actual humerus. But you get the point. So when we want to turn our hand over like this, it's not a movement at the wrist, as many people would think. And I'm hoping you can see this really clearly on the video. So I'm going to do it a couple more times for people to look. Now, what are you looking for? You're looking for the radius bone to rotate around the ulna. Because the ulna is joined into the humerus, it is very stable. It functions like an axis. And then when we want to pronate our hand, you can see how the radius rotates around the ulna. And I've tried to illustrate that in the picture there of the right forearm doing that movement. So if we work together, you'll see that your thumb goes from here back to here. And when our hand is supine like this, these two bones are perfectly parallel. And when our hand is over like this, well then we have the pronators that help to get our hand into that prone position.
Dr.
Let me just give you a couple of little reminders here. So the functioning of the axis is what allows that to happen. And the pronating and supinating of the hand is an important movement because when we are conducting, we need to have flexibility in what's happening here. So understanding that that hand movement is actually made possible because of the elbow makes for an easier and more flexible movement of the hands. And it also affects our fourth joint, which is the wrist. And as you can see in this picture here, we've got a shaded area, which is the carpal bones. And they are actually what comprises the wrist. So most people think of the wrist as a hinge. So when I say move your wrist, they'll just think, well, that's easy. I'm just going to wave at you like my wrist is a hinge. But the wrist is actually more than that. So what I would like you to do is just take two fingers, index finger and middle finger, and place them along from the hinge and up like this. And there, if you feel in there, these are your carpal bones. And the shape is quite ingenious. If you have a look at this picture that I have here, you can see with the hamate bone here, you can see there's an interesting kind of valley. We actually have a name for it, and you've heard it. It's the carpal arch. Okay, we've heard of carpal tunnel syndrome, which is compression of the nerves when they're running through that carpal arch. And there's many reasons why that can happen, and several of them are self-inflicted. So we want to make sure that we're preserving that arch by keeping pressure off it. So there's movement that we can perceive in 3 different places in the wrist. A wrist should not be rigid when we're conducting, nor do we want something floppy. We want our wrist to be firm but supple. And look at the 3 places where we can get movement. We've got movement between the carpal bones and the lower arm bones, right? So that's here at the hinge. Then we've got movement among the carpal bones themselves. And if you actually work in alignment and just play with your hands, you can actually feel that movement there. And then a larger extension, of course, is the movement between the metacarpals and the phalanges, metacarpals to the carpals, right? So the phalanges are here. Wait a minute, sorry. So here's the metacarpals. So phalanges on the end, metacarpals to carpal bones. So that's movement in 3 places, and that's all to do with wrist. And having beautiful fluid hands helps a lot when we're trying to paint text and when we're really thinking about how we get our hands on sound and what we're going to do to shape that sound for the sake of our singers. Let's have a look at some of the common mismappings. This one is the hand and the forearm relationship. And I've got 2 photos to show you here. On the left-hand side, you can see the neutral hand position. On the right-hand side, you can see what we call ulnar deviated. Let's just trace the whole arm first, and then we're going to get into this a little more. So what I'd like you to do is to bring your right or left arm, it doesn't matter, in front of you, bent at the elbow, approximately 90 degrees. And I want you to start by tracing from the tip of your little finger down the leading edge of the arm, find your elbow, and then come up the upper arm and around to the back until you get to the tip of your shoulder blade. Okay, so let me show you on Kiki here. I want you to start from the tip of your little finger, coming all the way down and around, and then you're going to come up. My goodness, this poor guy, there he is. You're going to come up and around to the back of the shoulder blade. That's a whole arm. And if you look at it on me, it looks quite long, right? Some people think, oh, you know, it's easier for person X because they've got long arms and I've got short arms. Actually, we're all in pretty much in proportion with where we need to be. So if you want to maximize your arms, you need to be working here from the sternoclavicular joint. Now, this mismapping of the hand and the forearm occurs when people organize themselves around their thumb and their index finger. So if you have a look at my model here, you will see that when we're in alignment, there is a space here between the ulnar and the carpal bones. But if we push our hand off to the side, as is the case with people who are organizing themselves around their thumb and their index finger, we then compress that space. And if we stay there, we actually get a little jammed up. So what I'd like you to do is just to take your arm, put it down on a horizontal surface that's nearby, and then just have a look and see, when you do that, do you have this kind of shape? Do you have this kind of shape? Or you have this kind of shape? There should be just a little tiny peak through there. What we don't want is this, which is the ulnar deviation. Now, don't get me wrong, this is a place I go. I go there often, but it is not a place that I stay, because staying here jams up and limits the rest of my motion. I actually want to be able to go here and here as well. So as pianists and organists in the room, you know that there are often times we need to get over to there, right? But if we're staying there all the time, it means we don't have the full range of motion, and now we're starting to get pain in elbows, and on it goes. Same at the computer keyboard, right? You want to organize yourself around the neutral relationship. So a lovely way to do that, and I'll show you this in some more slides in a moment, but let's just experiment now while we're in movement mode. Put your elbows together, align yourself with your little fingers, pull your hands away, and see how it feels to have that lovely, neutral, easy alignment. And then I can go in and out of that quite easily as I need to. So this is an important organizational point. Let's look at it structurally here. From the tip of the little finger through to the midpoint of the elbow, that is what we call the neutral or the resting relationship. This is the leading edge of the arm. So if you're thinking in terms of string playing with down bows, you're thinking very much of the power leading from that edge of the arm. Gesturally, when we're conducting, when we want to get strength, we're always going to work from the leading edge of the arm, not like this, and certainly not with our hands upward like this. So we've traced our whole arm alignment, and I just showed you a little bit about how to find that neutral relationship. Let's try it one more time, and let's see what it looks like with a full body view. So, taking our elbows together to the little fingers and then separating, and just find the place where your hands can be resting on the surface of the water if you were chest high in a swimming pool. So you don't want your hands down here. We don't want them hanging out in front of our face all the time. There are times when these are great places to go. But to try and find your default or your neutral, you want to be in a place where your arm is neither pulled up, pushed down, rolled forward, or pulled back. And this neutral relationship that I'm talking about is lovely because it allows you to stay spacious around the sound instead of compressing in on the ribs, which is really problematic when you're working with singers. It also gets away from that elbow flapping that's incredibly annoying, or what I call the T-Rex gesture, where people pull in and then just try to whip from the elbow. So think about working. So let's try a legato 4 pattern now. Think about working from the sternoclavicular joint. It's free there, following with our glenohumeral joint, our elbow, and our wrist, and then we communicate through our hands. How many of you have really thought about what's possible with your hands? So tonight I'm going to talk to you about the 19 joints in your hands. I want you to avoid claws or paws or other sort of derivations of that where people get stuck into a position and think they've got to hold that at all costs. If you have to hold a baton, that's a different issue, although you still need to have incredible flexibility, and you definitely don't want to be gripping it so hard that you get pain through your lower arm. So let's just talk about hands first. I like conducting with hands mostly because I can do more with the sound. My mentor and teacher, Joe Flummerfelt, talked about getting your hands on the sound. And even when I'm with my choirs with the New Jersey Symphony, we're working on a masterwork, always in the quieter a cappella sections, maestro will drop the stick and just work with his or her hands. Mapping the hands is just a simple case of finding those 19 joints. They start here, number 1, number 2, number 3, number 4, number 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. So when I take my model here, okay, and I just superimpose my hands over the top, okay, this is pretty close to the length of the bones that would be in my hands. You can see that we have a lot that's possible. Don't think about hands as flesh fingers. Think about your hands in terms of metacarpals to phalanges. So you want to avoid getting stuck with claws or paws. Free arms are crucial. We have many nerves that run underneath the collarbone and between the first rib, and you can see this here. So pressure-free arms are crucial for preserving reliable sensation in your hands, and that's actually one of the reasons I got into this work in the first place. I was conducting the Durafle Ubi Caritas with the sophomore choir at Westminster. And at the end of the piece, which is only 2.5 minutes, I could see my hand. I could not feel my hand, and it was just kind of trembling and numb. And what I found out later was that in my attempts to be pianissimo, I was actually compressing and gripping to the point where I lost reliable sensation. That sounds really dramatic, and it is. You only need to put the weight of a dime on a nerve and you start to lose reliable sensation. So conducting with excessive tension or force or misalignment is absolutely going to contribute to problems like that. Let's watch a little video, and you're not going to get any sound here. And this is just to give you a sense of what we're doing. My choir, the University Singers, and one of my student manager, Alexa, who's studying conducting with me, is actually here tonight. She's president of our ACDA chapter. So welcome, Alexa, and thank you very much, Max, for making her welcome. This is me working with the University Singers. They're socially distanced, so they're very far spaced out, and they're in a big circle. So I've got students all the way around me. And here we are in this largely outdoor structure. And I just want to show you an example. I'm having to overconduct here. I say overconduct. I'm having to conduct much bigger than normal because of the dimension of the space that we're in and the fact that people are so spread out. But you can tell from what you're seeing me do there that this is legato. And the support for my arm movement here comes from the liveliness and the tone of my whole body. So tone is described as that condition proper to muscles at rest, neither flaccid nor hardened, and a body that is balanced and ready to move from neutral and fluidly integrated aids our arms in the voluntary movement we do when we conduct. So help from the whole body also depends on the arms being perceived as parts of the whole. What I've heard pianists describe as fingers that start at my toes. So it depends on your sense of the whole body. Is it in relationship to the instrument that performs? Are you able to use your whole self when you're performing? Of course, the other thing that I've noticed is that when I'm conducting with a mask on, the students respond very differently than if I pull it down. And once we're further than 6 feet apart, I can, and I do that. But I've noticed that when they can't actually see my face, their sound is different and they respond quite differently than when they can see the gesture in my face. Now you can see a change in tempo, in character, and then there's a decrescendo and so forth. So now let's talk a little bit about gestural axis and center. And I want you to look at this axis here of the lines, and I want you to understand that when I'm talking about a gestural axis, I'm talking about one for each arm. So the center of the gesture does not come down the center line of the body. It actually lines up on the center of each arm. So if you simply put your thumbs under your arms and then bring your hands here and work in your peripersonal space, that is your vertical axis. Find it for your right arm, find it for your left arm. And there's a very good reason why we need to have not a center line here, because when we are using our left hand, we don't want it to get caught up and in the way. We also have symmetry in the body as singers. We have 2 lungs. We need to give our students, our singers, a sense of using that whole body freely. So if we start to limit things and restrict this way, it's going to distort their perception of what they can and should be doing. Everything you're doing gesturally needs to be supporting what they're doing technically in order to sing. And that means keeping freedom here so that the ribs can do their job, and we'll talk about that tomorrow. It means that you keep your arms floating and free. There's a lovely cushion of air or space here that doesn't require you to be pulling from here, right? And then we work around that axis to focus the sound and keep the choir in tune. So we've just talked about the axis that you find for each arm and each hand. The gestural center for each hand is going to depend on your height. So instead of trying to conduct like other people that you've seen, conduct like you. Use your power centers to make sense of your gesture. I'm 5'7½", right? If I try to conduct like somebody who's 6'6", their gesture will look ridiculous on me. Similarly, if I try to conduct like someone who's 5'2", that gesture won't work for me either. So it's important that you find what works proportionately for your height, for the breadth of your body, and of course, for the musical expressive demands. But at the moment, I'm just talking about orienting yourself with your basic technique. So I'm going to find my vertical here for each arm, right? And then where's that horizontal? Where's the table? Well, again, I like to think about standing in water chest high. Where would my hands float on the surface? And that's typically at about chest height here. And then if I bring my hands up, that's going to change the sound. Dropping my hands down here automatically signifies a deeper, richer sound. So you want to think about neutral so that you can orient your choir expressively depending on whether you're working up here, which is where you're going to be with lighter, softer, and sometimes stylistically, that's where our early music tends to go. And then of course, we've got down here for the stronger, bigger stuff. The juxtaposition of the vertical axes is also important because that tells us a lot about the quality of the sound, especially with regard to tone and dynamic. So for example, if I bring my hands together like this and have a very narrow window between, that's giving you quite a different sound than here. And what about when I bring my hands out here? So you're thinking about the table. You're also thinking about the relationship of one hand to the other. And some of you are probably wondering, well, is she advocating mirror technique all the time? And my answer to that is only when there isn't something else better for the left hand to be doing. So what I don't like to see in legato work is a left hand that just hangs by the side or just kind of sits here. Your left hand is needed for phrasing, articulation, for cueing, and other expressive information. And when it doesn't have anything better to be doing, it can be helping by keeping the sound supported and the motion and the flow of the line. So another reason why the juxtaposition of those axes is important. The placement of the horizontal axis, as I said earlier, varies again according to dynamic and musical style. But you want to find where is your neutral first, or if you like to call it your default. What's your Times New Roman 12-point font gesture? What does that look like? Let's go to anticipatory position and breath impulse gesture. So one of the mistakes I see in young conductors is that they'll get up to conduct and they get on the podium, and before they've even got themselves settled, they're off and they're racing. Take that time to really think about what is it that you're conveying. The position that you're in before you move, and that first movement must include breath, should set up an organic inevitability about what is to come. You're confirming for your singers what it is that they're expecting to see and they need to see. The breath impulse gesture is the moment where you breathe and you begin the phrase. The phrase does not begin with phonation. It begins with the breath and the movement of the arms in combination with that breath, which signals this is what you need to do. So in that sense, we're always signaling ahead. I heard someone once say that conducting is a series of preparations. It's a pretty dry definition, and yet it has a lot of truth. We can't be waiting until the moment we want something to happen. We have to be signaling it at least a full beat ahead, while staying in the time of the moment and also in our own heads thinking ahead. It's really quite complex. So the breath impulse gesture, for example, and I'll do more on breathing tomorrow with you. You need to see a release here. Breathe through the mouth, drop the jaw, breathe in tempo, coordinate your hands, and then on the exhalation, your hands are moving with whichever beat it needs to be, downbeat or whatever. Because of the lengthening of the spine when we exhale, our arms get a lovely boost in the coordination of their movement. But you've got to come back tomorrow to find out more about that. So what is it that we do when we're on the podium and we're trying to conduct with our singers? Certainly there are rehearsals where we have to do a lot of talking to explain things, especially early in the year. I get that. But more and more, we need to be teaching our musicians how to respond to what they see. So the first thing you need to do is organize for intention. What is that? It's beginning with an accurate mental conception of the outcome, be it the quality of movement or the musical sound. If you just simply start moving without any clear intention, you're going to get a sound that is ordinary at best, quite possibly out of tune, out of time. It's just not going to be well organized. Energy follows intention. So always use your intention to organize your movement. And of course, awareness must precede the movement. We need to be completely aware about what is happening. So that's why the two skills that I think are most important in conducting are breathing and listening. The breath is how we open our body physically and make ourselves accessible emotionally and spiritually to the singers. And again, that lengthening of the spine provides beautiful support for the gesture and the choral sound. You also want your singers tapping into their spinal lengthening. It's an involuntary movement, and as you'll see tomorrow in the demonstration I'm going to do for you, it's really quite a powerful tool. The second skill is listening. How do you know when it's right? Because you're listening. The sound gives you instant feedback. You've got the ideal in your inner ear, and then you have your reality. And it's reconciling those two without panicking. That's part of the game, right? So the gesture should be guided by the ideal sound concepts in your inner ear. And then if things aren't working the way you want, well, you get your hands on the sound, and hopefully the movement that you do can help to change it. Unless, of course, your choir has trained you to stop and talk and lecture them, at which point they don't respond to you other than what they're seeing in terms of tempo. So think about that and how that might help. Now, I just want to give you some ideas to try out with regard to legato patterning. And I've just thrown up here for you the 3 and the 4 pattern, which are the sort of your textbook directions for where 1, 2, 3, and 4 are. Okay, so that's just a little reminder. And now what I'm going to do is I'm going to have a little annotation share going on here, and I'm just going to move this guy up a little bit, and I'm going to first of all show you my legato 4 pattern, and then I'm going to draw it for you, right? So here we go. 1, 2, 3, and I'll just use the right hand for the moment. 1, 2, 3, 4. If I was doing the traditional pattern that I showed you before, it would look like 1, 2, 3, 4. How do you make that legato? Well, you can, but there's something that happens with that patterning, and a lot of people don't think about it. And that is that when you get to the point of the ictus, and because it's a point, you actually have to stop moving and change direction. With instruments, that's not such of a problem. But with singers, especially amateurs, that can be really tricky. Bear in mind, you're also the voice teacher for a lot of your singers. What do they need to do to keep their sound effective? They need to move air continually. And that's something that is facilitated by this patterning here. Most of you think that you're seeing that traditional pattern, but in actual fact, when I conduct this way, I'm doing this. 1, 2, 3, 4. Gonna clear that. Clear it. There it is. Try it again. So we come down the center line, and then I spin around to 2, to 3, and then up to 4. And what this allows me to do is to focus my icti here in the central part of the gesture, which helps enormously with keeping the choir in tune. Wait a minute. Let's go. Uh-oh, hello. Annotate, clear all drawings. There we go. So let's try drawing that for you so you can copy it down if you'd like to try it. Beat 1 is going to go 1. And then, so your 1 is here, and then you're going to spin this way. We're going to go 1, 2, right? 1, 2, 3. Pardon my mouse technique. It's so much harder to do this with a computer mouse. 1, 2, 3, 4. And 4 comes up and under there. You see that? So let's try that again. 1. So hit the beat and then come around to the right. 1, 2. 1, 2, 3. 1, 2, 3, 4. And to the untrained eye, it looks like 1, 2, 3, 4. That's what they think they're seeing. But what you are in fact getting is the most beautiful motion, continuation of sound, and bonus, you're getting a choir that sings more in tune because everything you're doing is gesturally focused. Here are a couple of things just to finish up with. Reminders. Audiences listen with their eyes, and our musicians respond to what they see us doing. So look like the sound you want. Good technique is essential for sure, but effective choral conducting requires imagination and nuanced expression, not just pretty hands, but all of you. Because of the mirror neurons in our brain, our singers will mirror our emotions via our body language, and audiences in turn mirror the performer's emotions via their body language. That's what I mean when I say that audiences listen with their eyes. So ensure congruence between what your singers see and what you say and do. So to finish with, imagination, intention, and listening. Our primary goal is to communicate the human impulses that underlie the musical moment. What is it that you should be listening for on the podium? And again, we could spend a whole week talking about this, but here are 6 things that I'd like you to consider. First of all, tone. I believe that everything begins with the tone. It doesn't matter how accurate the choir is, if the sound isn't beautiful, you won't communicate what you need. So a healthy, age-appropriate production, a sound that is breath energized. We want accurate pitch and rhythm, of course. And we want precision in the ensemble breathing and intonation. Line, that intensity of emotion and affect and motion that you show in your gesture. The line that shows the rhythmic subdivision and the breathing. Line is so incredibly important. That's why we did legato tonight with the patterning. Diction. People are very hung up on vowels, as they should be, because vowels relate directly to the tone. But please make sure that you have beautiful articulation that includes precise consonants. We have the gift of language, unlike any other musicians. It's incredibly important that we take advantage of it, and again, that our audiences can understand what it is we are in fact saying. Last but not least, dynamics and expression. They need to be in balance and germane to the affect of the music. So when you're on the podium and you're wondering, well, what comes next? It's all there in how you're listening. And I would ask you, is your intention clear? Are you showing the choir what it is that you want them to do? Do you open when you breathe? Is your gesture helping or is it hindering? Some references that I mentioned to you all last night. These are the same as last night, actually, because I think the work that we're doing at this conference really circles around important concepts about the voice as an instrument. But if you're interested in knowing more about the choral conducting side of it, I recommend volume 2 of Teaching Music Through Performance in Choir. If you're wondering why I haven't written a book about all of this, the answer to that question is because I think I would rather demonstrate, and I'm interested in developing a hybrid publication that is more interactive. Why would you buy a book about how to sing and not actually hear a singer or see a singer move? And it's the same with conducting. I think it just doesn't make sense. There's so many books out there about how to conduct, and there's still a lot of really bad conducting. So I don't think I need to write a book about conducting. What I want to do is show the relationship between movement and conducting and talk about it from this perspective. So one day when I get my sabbatical, that's what I'm going to do. Okay, we have, I think, 8 minutes for questions. Sorry, I was planning on 10, but it's I didn't want to rush, and I'm sure there's going to be a lot of questions, especially when it comes to the beat patterning. So Max, would you mind moderating the questions for me, please?
There were a few questions in the chat during the session, so I want to get to those. One was very close to the beginning. Was the comment was, I have to play piano for most of our rehearsals, so I get in the habit of talking through the instructions rather than using gesture to portray them. Any suggestions on how to use gesture more when at the piano?
Right, that's a really good question. Can I ask a question myself? The person who asked this, are you playing the piano to play the parts, or are you playing piano accompaniment?
Both. I only have an accompanist. Well, this year I have one twice a week, which is really exciting because last year was like just before, concerts. And so often I am there playing parts, but even once our parts are learned, now I'm playing the accompaniment as we work towards,
Right.
3 of the 5 days I'm the accompanist.
I feel your pain. That was me when I first started conducting. It was just sort of me and a bunch of students. And I very quickly located a senior student who was a good pianist and who was trainable as an accompanist, because pianists aren't always accompanists, as we all know. But one of the things that I've found helpful is to actually try and wean them and you off the need for you to play so much with the part playing, right? Because then they'll get more reliant on their own ears and trust their own resources more. Working a cappella is not the worst thing in the world, right? And again, it depends on how sophisticated the music is. There are times when they're absolutely going to need that accompaniment. But I would suggest that if you could really work with them with the breathing and the gesturing and get them to trust what they're seeing and listening, so that then when you are playing at the piano, guess what you can conduct with? Your breath. Not this, you actually, and you cue them. So you cue them with the breathing and they remember that and off they go. Other colleagues in the public schools here in New Jersey who have this challenge as well, we've talked about it at a lot of workshops, and people generally agree that the more they can work a cappella so that the students get used to seeing their hands, and then when they have to take their hands away, the students are a little bit more self-reliant, and you can actually talk to them about, look, this is what's different today, right? And then when you do get that accompanist who's there, ask yourself, am I doing the things musically and gesturally that make sense? Yes or no? Because sometimes I know it's very hard to switch from one role to the other. I hope you're at a piano where you're seated up so that they can see your upper body, right? And I would really encourage you to breathe like crazy. Alexa can tell you right now, I'm teaching my students how to conduct without their hands. They're learning to conduct with breath. I've got one student who just thinks that I'm killing him. And it's like, you don't get your hands back until you breathe, buddy. That's how this goes. So yeah, so there's a lot you can do with breath and your facial expressions. You have a very expressive face. So use that to your advantage as well. You know, pretty hands are one thing, but they're only one tiny bit of what we do.
Max can direct with his mustache, you guys. I don't know.
Yeah, that's right.
Hey, listen, Max's mustache needs to be like patented, like that. You know, it's got its own following on social media, right?
It's part of the branding.
I know, right? Okay, what's our next question?
Another one, and this is when we were talking about you were talking about the mapping of the shoulders, and the shoulder structure. It says, my shoulder keeps popping in 3 places when I lift my arms 90 degrees. Is that bad?
Okay, so who is that? Who is the person that's asking that question? Hey, Catherine. So the first thing I would say to you is you need to go and get a medical consultation to find out why that is happening, right?
The chiropractors don't know.
Okay, good. So then I've
They're
done my
rotate and it'll pop, and I can go like this and
right,
it'll pop.
right. So yeah. So here's the thing. You look like you're a little hypermobile in some of those joints. Yeah. So you actually need to be working with someone to get stability and strength in those joints. There's a physiotherapist, Bronwyn Ackerman, who's on our science board, and she was talking a lot about hypermobility in musicians. I was interested in that because I have a daughter who's a cellist, and she's hypermobile in a few joints that are kind of awkward as a cellist. So when you have that hypermobility, you need to work with a physical therapist who can help you get strength and stability, right? Now, sometimes people get some cracking in joints. That's just synovial fluid releasing, a few little air bubbles or whatever. But and that's not a big deal. But if there's grinding or anything like that, no, you stop. And the only appropriate thing is to go to a physician or some other health practitioner who can do a diagnosis for you. Because I'm a doctor, but I'm not that kind of doctor. So I want to make sure that we're working educationally and appropriately. And if they come back and say, we don't know what the problem is, we don't think there's anything to worry about, then happy days. We'll talk about what you're actually doing with your alignment and so forth. Yeah. Thank you. Okay.
I think Serena Clark had a question. Her hand is up.
Now I saw Serena. There she is. You're up in my top left-hand corner. Hi, Serena.
Hi, Heather. I just had a question about, I was very interested in where you were having us set that plane,
Yes.
because that felt actually lovely and very natural. And what if we were taught differently in conducting courses?
Yes.
It feels like it's been a battle between what my body wants to do and what I've been told to do, which is lower, actually, is the plane I was trained in.
Yep, absolutely. So
It
the
gives
first,
a lot of discomfort here.
because you've been working in the lower
When I'm
plane.
low. Mm-hmm.
Exactly. And that's one of the reasons why I teach the plane where I do. Because when you're taught to do the plane lower, what are people doing? They're compressing and pushing down. Right? It's and I can I just be bold enough to have a guess? Were you taught conducting by a man?
Yes.
There
Both
it
at
is.
the undergraduate and graduate level.
Yeah, I know. Guys, with all due respect, you know, let's talk about power centers for a minute, right? So when guys want to fiddle, where are they going to go? Hands in pockets, it's all down here. What about the girls? It's going to be here, it's going to be here. Just about every male colleague I have is automatically going to go lower because that's how they feel themselves. But do you remember I said to you, you need to find what works for you. I don't want to go to a conducting convention and see a whole lot of people who look like mini me. I don't want that. I want them to look like themselves. You have to put your hands in the right relationship to you. And if anything you're doing gesturally is causing discomfort, then you're doing something wrong. It's not right, ever. So that means reconsidering what you were taught in relation to what feels right and what feels advantageous for what you're trying to do musically. And I do understand, Serena, I'm a rule follower too. I mean, I was told to sit up straight. My God, back in the 80s, I was wearing double shoulder pads to try and look like that I had shoulders. You know, some of you are laughing. You remember, right? The double shoulder pads. I had shoulders pulled back. I mean, my parents would put a rod down the back of our clothes at the dining room table. You know, the Buchanan kids were never allowed to hunch. You know, it was always like this. So, you know, I was the poster child for perfect posture until I met Barbara Conable. And everything I thought that was good, I found out was wrong. And then it was like, oh, that explains the lower back pain. That explains this. That explains that. So, you know, I will just say that the plane, that horizontal table, it moves. You know, when I'm conducting, so I'm going to play you the Battle of Jericho tomorrow. When I'm conducting the Battle of Jericho, I'm down here. You know, when I'm conducting Saint-Saëns Calme de Nuit, I'm going to be up here. If I'm conducting Mendelssohn's Verleih uns Frieden, I'm going to be here. That horizontal level changes. It has to change according to what you're doing stylistically. So the other thing I would say is find variety in your movement as well. And then we need to have a conducting class. That would be fun.
Amen.
Yeah. So it's a good question. It's a really good question that you ask. You know, just try it on. Just try different things and see what effect it has on the sound of your choir. You know, the gesture that is right. Joe Flommerfelt taught me that the gesture is that's right is the one that gets the musical result that you need. Yeah. Right. Who's next?
I don't know. Let's see if I can see any.
I'm running. I just want to make sure. Am I running you out of time? Like, am I?
I think people have questions. We want to make sure we can get them
Okay.
To you. So, anybody else? Do I see anybody? I'm looking.
Well, I have all the time in the world, but I just want to make sure that I'm not making the conference go overdue.
Questions. So I think. Oh, Brenda Winkle has a question.
Brenda.
I'm very curious. When you mentioned that when you're masked in front of your choir, that they're responding differently. I was wondering, when you go back, when we all get to go back to one day not wearing masks, will you change any of your facial gestures based on what you're learning right now?
No. No, I actually, you know, that Alexa might like to answer a little bit about what it's like to sing for me when I'm in a mask or not in a mask, and then I'll answer your question more specifically.
Sure, I could do that. I think as one of Buchanan singers, she's always very embodied and very expressive, even when she is wearing a mask. But when she doesn't have her mask on, the choir is so much more in time. They're also embodied themselves a little bit more. We're able to see a little bit more and interact a little bit more with her. And I would say that we're just a little bit more cohesive and a little bit more together when we can visually see exactly what we should be doing. Especially with the breathing. So I'm a big breather when I'm conducting. You know, it's interesting. I don't feel like I do anything differently. In fact, the other day I'm conducting away merrily and I'm getting real cranky with them because it's just not what I think I should be seeing. And then all of a sudden it hits me like a ton of bricks. I've got that damn mask on. So I literally just pulled it down, and I kid you not, it was just like somebody got under the choir and just went shook, and off they went. And, you know, in that moment, I'm getting chills thinking about it. We were in a parking deck, but, you know, there it is. And in that moment, I just thought, you know what? They've got to see. They've got to see, right? It really makes a difference. I mean, 93% of human communication is nonverbal. So what they see is tremendously important. What will I change when we go back together? I will never, ever complain about my commute to campus again, ever. I live 60 miles from campus and I have to drive on the New Jersey Turnpike. That's like a special form of torture, except at the moment it's really exciting because I will never again take for granted what I have. It's been amazing. Now, can I tell you all something really exciting? How many of you know, shall I tell them, Alexa? Yeah, I should tell them. Kelly Clarkson. Does the name Kelly Clarkson mean anything to you all? So if you watch her show on Tuesday, my choir and I are featured guests on the Kelly Clarkson show. We're having a little COVID blip at the moment. So instead of performing live on the show, which was originally planned, she's going to play a recording that we made a week and a half ago, but the choir's still going to be there with our masks on, and she's going to do a live interview with us this Tuesday. So I think it'll be around 2:30 Pacific time. So I think that's about 3:30 your time. So yeah, so we're all a little starstruck, and everybody's fanning over Kelly at the moment.
Fantastic. Dr. Buchanan, thank you so much for this second wonderful presentation.
Thank you.
Thanks so much.
I just want to respond to Glenn.
Oh,
Glenn, yeah, Glenn, I actually have bought masks with the clear panels in them because I teach a class in articulation and diction. And, you know, unless it's got a lot of air exchange in there, all you do is fog up. And our COVID practice at Montclair is so strict that that's not acceptable. So it's a bit like the candle test. If you can blow out a candle through your mask, then you may as well not be wearing one. So any mask that allows that much air in is also unsafe because it's allowing too much of my air out. So I have tried that, but it doesn't work for me. So I just put the choir 12 feet away from me outside and pull my mask down. That's what I'm doing at the moment. Anyway, that's it from me. Thank you all so much. Please come back tomorrow because we're going to talk about breathing. And then I want to share some really cool ideas and some music with you that my students and I were working on season before last. And hope it will be inspiring for all of you.
Great. Thank you, Dr. Buchanan. Let's give Dr. Buchanan our appreciation. Thank you so much. Fantastic. Hey everyone, I'd love to give you about 7 minutes to do what you need to do before we go into